The moderator of both of the panels today is Dr. Arthur Astorino, Jr., the founder and chairman of Americans for Free Choice in Medicine. When he started his practice in 1988 as an ophthalmologist in Newport Beach, the first thing he really encountered in the way of unpleasant surprises was proposed HMO contracts, all of which had a very interesting arrangement by which the less he did for his patients, the more he would be paid. He recognized that this contract with an insurance company was in conflict with his concept of the proper doctor-patient relationship, and so would never agree to them. On the 4th of July of 1992, while driving home, he heard the Declaration of Independence being read on the radio. He was struck by this statement about King George. He has erected a multitude of new offices and sent hither swarms of officers to harass our people and eat out the substance. He thought it sounded familiar. He realized that was exactly what the government was doing to healthcare. He met with the healthcare task force, the Clinton healthcare task force, the following year, and realized the only thing they were interested in was in how to control the providers, how to control doctors. He believed that if the public only knew the facts of where the problems came from, they would demand the proper solution. His action was to found AFCAM in 1993. Since 2005, AFCAM has published about 50 op-eds by me and Jason Segal, which have also circulated in many other newspapers and many other websites. We've published many letters in major newspapers, about 200 in that time period, including 37 letters in the Wall Street Journal, which I think is unprecedented, 12 letters in USA Today, and most astonishingly, 5 in the New York Times. Dr. Astorino has been interviewed on radio and television and has lectured nationally on this topic. He has served on the technical committee for the Council of Affordable Health Insurance and has been a board member of APPS. In addition, he continues to practice ophthalmic surgery in Newport Beach. Now to present healthcare policy, diagnosing the problem, please welcome Dr. Astorino.
Well, thank you, Richard, and welcome. I want to thank you all for being here today. At some level, I believe you all realize that this is truly an issue of life and death. And unfortunately, our politicians, I believe, are taking us on the path not to life. Now, most people believe that there are so many problems with healthcare finance that it's impossible to solve them all. This is true if you believe that you have to solve every perceived problem. I will show you, though, that most of the problems are simply symptoms. I hope to convince you that there's a single cause for all these symptoms. That is, I will approach this like a doctor approaches a patient. To make this analogy clear, let's consider a patient presenting to a doctor with several symptoms. Say, a red eye, pain, fever, night sweats, cough, chills, weight loss, fatigue. Now, a doctor doesn't approach this like 8 problems to solve. He recognizes these as symptoms, and he looks to discover the single cause. In this case, further examination would reveal this patient is suffering from tuberculosis. And curing that condition with the appropriate antibiotics relieves all the symptoms. If we take this same approach to the symptoms of healthcare finance, we can make a proper diagnosis and effect a proper cure. Now, what are some of the prominent symptoms that we hear about in medicine? It's too expensive, there's too many uninsured, people have pre-existing conditions and they can't get their health insurance, many people are uninsured when they change jobs, billing and paperwork are nightmares, etc., etc., etc. The first thing a doctor would do is to take a history. The first question that would come to mind would be, why do we get our health care from our employer? When did that start? Has it always been the case? Well, our history must take us back to around 1940. FDR instituted a wage and price freeze, fearing that the loss of workers for the war effort would result in a raise in wages and prices as employers tried to attract the dwindling workforce. Consequently, employers tried to attract workers with health benefits. By 1942, the IRS caught up with this and was going to tax the health benefit. By 1943, the IRS granted a tax exemption for employer-owned health insurance after political pressures were applied to Congress by the unions. Today, that exemption means it is free from FICA, state, and federal income tax, which amounts to about 25% to a 60% reduction in the cost of your insurance when your employer buys it for you. What does this ruling say in principle? If you're personally responsible for owning and purchasing your own health insurance, you have to pay a lot more. If you can get your employer to pay for it, it's a better deal. This policy fundamentally discourages personal responsibility in the realm of medical care. Did the market respond to this incentive? Yes. In 1940, only 9% of people had hospital benefit plans. By 1950, over 50% did. And today, over 95% of health insurance policies are owned by the employer. Consequently, they're not portable. This creates the uninsured issue when people change jobs. It also leads to job lock, where people feel trapped in their job because they may lose their health insurance if they change and they have a pre-existing condition. And then those with the pre-existing conditions, when they do leave their job, are unable to get private health insurance. None of this would happen if the insurance was personally owned. So, is discouraging personal responsibility by government policy a good idea or a bad idea? I submit that it's a bad idea, and it has resulted in these and many other destructive consequences. Now, is there a deeper issue underlying this? To help you consider this, I would like to quote our first president. Government is not reason. It is not eloquence. Government is force. Like fire, it's a dangerous servant and a fearful master. George Washington, 1797. Here, Washington recognizes that fire as our servant heats our homes, cooks our food, and enhances our lives. And government as our servant should protect our rights and our property. However, like fire, when out of control, it will destroy the things we value. FDR utilized the force of government to dictate the wages that private employers will offer private citizens. What right did he have to do this? Congress forced you to have your employer own your insurance policy in order for you to get a tax break, and penalize any of those who purchased their own insurance. No other particular fact that you discover about healthcare finance will alter this fact. When you recognize this principle, the inappropriate use of government force discouraging personal responsibility, you will begin to see it everywhere. Any reform idea that does not recognize this and address it will not cure the problems that have resulted from it. What are some of the other consequences of this employer-based health insurance? Most people want to use their medical insurance for almost all medical interactions. Compare this to your auto insurance policy or your homeowner's insurance or even your life insurance. Are you dying to use your life insurance today? No, no. Real insurance covers catastrophic, unexpected events, protecting you from financial hardship. Why is that not the case in medical insurance? Well, once health insurance was provided by the employers, unions eventually bargained for 100% coverage. The concept of medical insurance became equated with comprehensive medical care. One consequence of this was that actually insurance companies became villains when they denied coverage for valid reasons, like pre-existing conditions, because it was viewed as if they were wrongfully denying people care. Too many people today believe it's okay to use government force against insurance companies to cover everyone regardless of risk or the certainty of needing medical care. These are referred to as guaranteed issue laws. Now, to understand this, let's consider insurance in another realm, homeowners insurance. Currently, you're able to deduct your interest on your home mortgage. But for purposes of this hypothetical example, let's assume that this deduction is only possible if your employer purchases your homeowner's policy for you. Consequently, almost everyone has employer-based homeowners insurance. Your house catches fire. You're between jobs and have no homeowner's policy. You immediately call an insurance company to get coverage. Your request is denied. You believe this is not your fault, and you and others complain to Congress. Eventually, a law is passed that requires all homeowners' policies to guarantee coverage of fire losses after the fire has started. Now, this is just like the guaranteed issue law that exists today in medicine. More people choose to go uninsured until their homes are burning. Rates skyrocket to cover the cost of all the uninsured homes. Government force establishes a mandatory rate cap on insurance companies. Government force mandates everyone to own homeowners insurance and establishes fines and imprisonment for non-participants. More government agencies and policies are established to enforce these new regulations and mandates. Government force is being used everywhere to try and fix the consequences of its first mistake, discouraging individual ownership of the insurance policy. This is precisely what's happened to medicine today. In medicine, how do our politicians propose to cure the symptom resulting from employer-based insurance? They vilify employers that don't offer insurance and propose to force them to offer it. They see insurance companies pricing risk by sound actuarial methods and then ask them to apply unreasonable standards such as guaranteed issue. They blame the uninsured for not contributing their fair share to the insurance pool. They propose to force all individuals to own insurance with consequences of penalties and fines. All the proposed solutions only offer more government force. All these ignore the cause dating back to 1942. Before producing more mandates, fines, penalties, government should first offer the same tax exclusion to every individual. And that's our first step for healthcare reform in the private sector. Now, remember when we discussed that back in 1940, 90% of Americans were uninsured? Did that mean that 90% did not get medical coverage? Of course they did. At that time, access to medical care was not synonymous with health insurance, and it was generally affordable without insurance. Why is medical care not considered affordable today? Many think that medicine is more expensive today because of advances in technology. However, automobiles, telephones, computers all have more advanced, more powerful, and they've all become more affordable. Why didn't this happen with medical technology? So, the last symptom I want to cover is the high cost of medical care. Another consequence of almost 100% insurance coverage by the employer was that normal market forces were not applicable with health care. Patients generally did not shop by price, but they only sought quality, and medical professionals had no incentive to cut costs, only provide quality. Between 1945 and 1965, this mentality took root. And by then, medical care was something that people expected someone else to pay for, the employer. And the model for that care was to do whatever was best without regard to cost. Since health insurance was tied to the employer, employees were faced with purchasing private health insurance when they retired. Many of them did, but some were not insurable. And they had to rely on their own resources or on charity. Up to 1965, there were charity wings in almost all the hospitals, and everyone got care. Even so, politicians considered this elderly uninsurable issue a problem, and they wanted to solve it. Did they recognize this as a consequence of tying insurance to the employer, as a consequence of discouraging personal responsibility? Did they diagnose the problem? No. In 1965, Medicare and Medicaid was pushed through Congress by Lyndon Johnson, suggesting that it was degrading for the elderly and poor to be dependent on private charity. This is the charity of the doctors and hospitals that gave their care for free to them. And a means test is incompatible with human dignity. Here from a talk given by Leonard Peikoff to dispute the claim that it's advanced medical technologies that drive up cost. The normal pattern in a free market, exemplified by automobiles and the computer industry, is that a new invention is expensive at first, so that only a few can afford it. But inventors and businessmen persevere, aiming for the profits that come from a mass market, Eventually, they discover cheaper and better methods of production. Gradually, costs come down until the general population can afford it. No one is bankrupted, everyone gains. Ever since Medicare, when new inventions in medicine were discovered, such as kidney dialysis or liver transplants, they became immediately available to everyone by right. Simply invent the next cure or machine and then sell it to all the hospitals. There's no incentive for innovation to focus on reducing costs to establish that wider market. The market is there as soon as you invent it. This is not fraudulent on the part of the inventors. This is precisely what Medicare was set up to do. But what Medicare was set up to do is wrong. It was wrong to establish medical care as a right and use the force of government to tax one person for unearned benefits of another, and then to pretend that this is an insurance system. Medicare's introduction into the market raised the cost of hospital stays and began to affect most of the private insurance. Companies began to notice a 20% inflation in their insurance rates. And government stepped in to help by establishing PPOs and HMOs to reduce the costs and reduce the choices, and to reduce and incentivize the doctors to provide fewer services. Now, even Medicare noticed that its costs were out of control. But did they question the principles of their system? Did they diagnose the problem? No. They just abandoned their commitment to just pay the bill and to leave the doctors alone to practice medicine. They created 200,000 pages of regulations and controls on doctors and hospitals and hundreds of government agencies, all addressing symptoms, none fighting the disease. Thomas Jefferson: I predict future happiness for Americans if they can prevent the government from wasting the labors of the people under the pretense of taking care of them. Do you know how much 200,000 pages of regulation is? This ream is 500 pages. 400 of them stacked from this table would reach over 73 feet. That's 7 stories of regulation. Wasted labor under the pretense of taking care of us. At this point, I would like to summarize the history in principle. We discouraged personal responsibility starting in 1942. Consequently, we eliminate a free market in medical insurance with employer-based third-party care. And we further destroy the creative capability of individuals and markets to produce efficiencies by introducing Medicare in 1965, effectively eliminating free market economics in all of medical care. As costs spiral out of control, we begin to take away the freedoms that Americans also enjoy. We restrict patient choices of doctors and hospitals. We tell doctors and hospitals what to charge for their services by law. We force insurance companies to write policies to state-mandated benefits and force them to guarantee issue. We restrict building of new facilities with certificates of need, etc., etc. 200,000 pages. Freedom of choice is unsustainable without personal responsibility and free market economics. In essence, our patient, the body of the American medical system, is riddled with the infection of government force everywhere. And the concept of individual rights? Well, when it comes to medical care, that's been abandoned. Historically, there is one system that produces the best value: capitalism. It is based on the idea that individuals can trade with each other freely. Government supports the contracts made between individuals, but governments do not write those contracts. As we think about all the government interference in our lives and the mess that is made of medicine, let us recall Washington's statement about government. Government's not reason. It is not eloquence. Government is force. Like fire, it's a dangerous servant and a fearful master. Is the government acting as our servant in all these areas, or as our master? I contend that we have a wildfire of government force reaching into all aspects of our lives, slowly and insidiously destroying the things we value. I believe it's time we put the fire out, and I welcome you to join us. Thank you.